So we know that as we age, we know aging well depends on many factors. One that we can't change today is our genes. We're born with the genes that we have. And if you look at generations, you'll see people that look like they are 60, but they're actually 80. And they say, well, they inherited their good genes from their parents. And you can see this trend. But we do see as well that environment and our lifestyle plays a big factor on how we age as well. And a lot of the lifestyle choices help maintain that healthy body and brain. And in previous presentations that I've given to medical students and residents, and one here before, I asked the community how much of a factor that the medical services, hospitals, clinics, physicians, all play a part in a person's individual health outcome. And I had things ranging from 30, 50%. The fact is, a health system gives you about a 10% factor in your individual health. Our genetics are another 20% or so. The biggest thing is our environment and our lifestyle. And if you factor those two things together, environment and lifestyle, you're getting to between 50 to 60% of our individual health outcome that is impacted by those two areas. We know that when our memory and learning changes as we age, and it is very common and in fact normal for an increased difficulty finding words. Sometimes it's that word salad, and I had that this morning with my wife. I was telling her about coming over to Newport, and she asked, well, what topic were you going to talk about? And it took me that recall. I could hear everything and feel everything in my brain trying to catalog exactly what it was. And I couldn't tell her that split second moment, but I could in about 5 seconds. And it's just like, so many people will notice some little triggers of changes in the memory. We all have problems with multitasking. My wife thinks that actually is a genetic thing, that she finds that women are much better at multitasking, and she thinks it's a fault of my Y chromosome. But, and maybe there's some truth in that, we don't know. But we do know that as we age, we do have more problems with multitasking, meaning we have to get done with one project first before we feel we can get on to another one, otherwise we lose track. We also find that there is a decrease in the ability to just keep paying attention. Our mind may wander a little bit, drift, come back to the conversation. But the wonderful thing about the power of our brain and our body is that we can still learn new things. Life is a journey, and we can create new memories with all of these other aspects of our journey, and with that, improving vocabulary or language skills. I know of some people, as they age, they go and buy a brand new dictionary, and it's their mission that they're going to read a page of that dictionary each and every day to learn new words. But what are some of the risks or threats that we have to brain health? We know that there's many medications, sometimes improper use of our medication that can affect our brain, can affect our mind. Smoking is a large factor when it comes to brain health, and I'll go into that in a little more detail as to why. Excessive use of alcohol. Now you may ask, well, what is excessive? Currently they state that more than 1 drink for women is excessive a day, and more than 2 drinks for men is considered excessive. And if you did that each and every day, alcohol, while there might be some health benefits from a heart perspective, keeping the platelets a little less sticky, we find that we do have to recognize that alcohol itself is a toxin and is a neurotoxin as well, meaning it does affect our brain. So if you have very regular use of alcohol, it can start to create barriers with your memory and with your cognition. We understand that heart disease, diabetes, and other health problems can also be a factor, and I'll go into the why a bit later. But poor diet. If we have a diet that's very heavy with simple carbohydrates, your sugars, you'll get a sugar spike, and then it will go back down again. And these sugar spikes up and down throughout the day due to a poor diet can definitely give problems with brain health. Insufficient sleep. Sleep is the still unknown when it comes to understanding the body and physiology. We know we need it, but we don't really 100% understand it. And if you took a person with poor sleep and kept them awake every single night for a period of a few days, you're going to start to see their brain health deteriorate. Their memory, their cognition, their ability to understand and be coherent, it all starts to have a deficit. Lack of physical activity. When we move our bodies, we send more circulation to our brain as well. And that circulation of our blood flow and our different nutrients going to the brain to keep it as alive as it can be is extremely important. Little social activity and being alone most of the time. Social isolation is a big factor as we age. We may have spent our whole years with a spouse, with a partner, and all of a sudden that partner or spouse has passed away or has left. And all of a sudden that person you had beside you is not there anymore. And it does give a lot of people that feeling of social isolation. So it's extremely important to look at your other connections with your community, with support groups, and try to avoid social isolation as much as possible, because that's a very large determinant with brain health. There are some medicines and combinations of them that can affect our thinking. So it's going to be really important to talk with your healthcare provider. Many times doctors will start patients on medications, and then we as patients think, well, this is it. This is what I have to stay on forever. And things change. There may be newer updated medications with less side effects. There are certainly certain medications that you may need to stay on, but it's always an evaluation. If you're on a medication for high blood pressure, one called a beta blocker, beta blockers in the elderly can start to mimic some and create some symptoms of depression. And beta blockers are really important for high blood pressure and for our heart, especially if it's racing really fast, or if you've had a heart attack. A beta blocker helps with that remodeling, preventing that remodeling from occurring. But if you've lost weight, given up smoking, decreased alcohol intake, all those factors could have an effect on your blood pressure. And your blood pressure may get to a point where it's getting lower and lower and lower, where you don't need the same dose of the beta blocker that you once had before. So it's always good, even if you're feeling well, to think of having a medication review with your primary care physician. Many clinics now are trying to have integrated pharmacists within their primary care clinics as well. Some of them manage the Coumadin levels, the warfarin or Coumadin that you might be on for atrial fibrillation as a disease. And many of those pharmacists will often assist you with the medications too and give recommendations to the primary care doctor. Smoking and brain health. The benefits of smoking can be seen at quitting at any age. Even if you're in your 70s and you decide to quit, you will see a benefit from quitting smoking. There's a lower risk of heart attack. There's a lower risk of stroke. There's a lower risk of lung disease, even if you smoked for many years. The thing that affects the brain the most, stroke, but also heart attack. Many people think that only your heart is affected. If your heart has had a heart attack and then it starts to remodel afterwards, you're not getting as much of the blood flow going to all parts of your body, and your brain is included in that. So we really want to see that with smoking, you get a better circulation over your whole body, and also there's good benefit with not exposing others to secondhand smoke as well. And we have resources within our health plan and within the communities for anybody that is willing and needing help to quit smoking, and you can do it at any age. Now, is it difficult? Absolutely. If nicotine that is present in tobacco was first realized today, they probably would have had it illegal, because nicotine is just as addictive as cocaine and heroin. How's that for a surprise? Alcohol's effect on the brain. So we know that the brain cells, they all communicate with each other with little things called synapses. And even with moderate use, alcohol starts to slow down that communication channel between the synapses, between the different brain cells. And if you've ever seen somebody that was inebriated, or you yourself had been inebriated, you see that you might have a slurred speech, fuzzy memory, drowsiness, dizziness. Well, with long-term, regular high use of alcohol, this can become your new norm. where you wake up in the morning and you get through the next few days and you're still having a fuzzy memory or drowsiness or dizzy sensations, and you're not as sharp as you're feeling. It's like that hangover that might last for several weeks. And we now know that with excess use of alcohol, the brain's ability to overcome that excess use, it takes longer for the brain than the other parts of the body. So the brain is definitely affected with high use of alcohol. Long term, we can see that there's changes with balance and memory, coordination, or even emotions. Our emotions are regulated by our brain. And with long-term regular high use of alcohol, we can start to have true personality changes that occur. Some medications are very dangerous when we combine them with alcohol. One class of medication that comes to mind is a class called benzodiazepines. And that class of medications are things like Valium or diazepam or lorazepam or Ativan. This whole class of medications can be affected significantly with alcohol, where people may lose their balance and hit a rug and then hit the floor, break bones, etc. So now, that class of medications is what we call on the Beers list, or a high-risk medication, meaning anybody older than the age of 65, there may be more risks of staying on the medication than there is benefit. So you may have some of your primary care doctors talking to you about this specific class of medications. But there are other common conditions also that affect the brain. Heart disease and high blood pressure. When your blood pressure is high in your body, you don't get enough blood flow going to your brain either. And over time and untreated, it can actually lead to a syndrome that is very similar to Alzheimer's dementia. It's called multi-infarct dementia. And it's like your brain is having a variety of mini strokes, and you may not know it, but over time it can give a dementia picture, very similar to Alzheimer's. Diabetes is a disease of the blood vessels. We always think that it's high blood sugar, and it is. But the high blood sugar, left untreated over time, starts to affect all of the blood vessels in our body, which leads to decreased circulation to the whole body. That's why we see eye problems, kidney disease, and then brain disease along with heart disease. Alzheimer's disease is one thing we always think about, and I think it would be one of the most scary diagnoses for people to consider. And when we ask people throughout their lifetime and their spectrum, what's one of the most worrisome things that they ever could think of? And Alzheimer's disease comes to mind. It's one of those top things, up there with cancer. It's something that people are very scared about developing. And maybe they've had family experiences with it or seen friends that have been affected by it. And it is very hard. And Alzheimer's patients die earlier than patients that do not have Alzheimer's. Strokes. Strokes are very important to try to prevent. And we can have different types of strokes. Strokes that occur from a clot, and strokes that occur from a bleed inside the brain. Both of those types of strokes can give long-term changes to the brain as well. Traumatic brain injury. We're learning more and more about traumatic brain injury with our professional athletes. We didn't think about this a couple decades ago when we were watching the Super Bowl, and now seeing some of the people that have played football for years and had traumatic brain injuries with repeat concussions over and over, that it does significantly change the brain. Depression is another disease that does start to remodel and change the brain as well. And then I already talked about sleep problems. As we age, we usually find that we sleep less than we used to. And so trying to look at your daily amount of sleep, not just the amount that you might sleep at nighttime, but it is completely okay to have those little cat naps here and there to try to make up for the sleep that you might not be getting in the nighttime. Heart disease and high blood pressure. As I said earlier, it can lead to stroke and blood vessel changes that are related to dementia. It's called this multi-infarct dementia. So how do we best reduce heart disease and high blood pressure? We want to control our cholesterol. control our high blood pressure. And what's our number that we're trying to aim for most people? It's 120/80 and less. There may be circumstances where you may need to have your blood pressure at a slightly higher level than that, but that's a decision with you and your primary care director, or primary care physician. Exercise, extremely important. And part of our exercise regimen today was finding parking and then walking a couple blocks getting here. So we all got our extra steps in. But keeping your body moving and keeping that blood flow going is extremely important for getting that blood flow coming up to the brain. Eating healthy foods, quitting smoking, and limiting use of alcohol are all other areas we want to focus on. With diabetes, I talked about the damage of the blood vessels throughout the body, but this increases the risk for stroke and heart attack. And we're now wondering if there could be an increased risk for memory problems because that high blood sugar is always staying higher in the brain as well and activating. So they're wondering if there could be some links with Alzheimer's disease. This isn't proven, but it's just some theories. So maintaining a healthy weight by keeping yourself active, eating healthy food, can prevent or control diabetes. And at any age, we've seen people that have had a 10% body weight reduction and seen significant improvements in their hemoglobin A1C to the point of sometimes getting off of medications. So we can always change things in our body. Alzheimer's. What this is, it's a harmful buildup of proteins in the brain. And this leads to death of the brain cells and that loss of connections between them. So I talked about those synapses. That's how our cells talk to each other. And with Alzheimer's disease, we lose those connections of our cells talking to each other because those brain cells are dying off because of this protein being deposited in areas where those healthy brain cells should be. And we know that the risks for Alzheimer's is, as we age, that's an increasing risk for it. We see it more so in older people than younger, but there is a certain early onset Alzheimer's as well that affects people in their 40s and 50s. Genes in some people. Sometimes there could be a genetic predisposition where family members, there's clusters of family members that get it. Definitely head injury can be associated with that and is a known risk. And then things we're suspecting might be risks. Heart disease, high blood pressure that we start to get in midlife, lack of physical activity may be associated, and then depression and diabetes. So again, looking at all these things we can try to adjust and change through lifestyle. Some therapies can treat Alzheimer's disease, but they don't slow down the disease's changes in the brain. What they do is they reduce that cognitive decline, the rate of that decline, but there's more testing that's going to be needing to be done. I was reading an article over the weekend where they're looking more and more at PET scanning and trying to predict levels of Alzheimer's disease. But right now it's a test that's about $5,000, $6,000, and so they need more studies to see if it's actually useful so that Medicare would cover it. We're not there yet, but there's always a lot of work that's going into looking at Alzheimer's disease and trying to predict who might be more at risk. So again, what can we do? Lifestyle. It's exercise, healthy diet, controlling those risk factors of high blood pressure, heart disease, training, and keeping your brain alive. So just like we exercise other muscles in our body, we should try to do tasks to exercise our brain, and that's through different brain training techniques. Brain injury. As we age, our balance does go, and we are at higher risk of falling, and we can have other accidents can cause also a brain injury. So there's balance and coordination classes that can be taken to try to retrain the balance centers of the brain and make it as healthy as it can be. But looking at your home and doing a fall inventory, are there area rugs on floors that are a recipe for a disaster with falling? They look nice, but they can get under our feet and trip us in a moment's notice, and then down we go. So looking at a home safety intervention is really important. But reviewing medications and your vision with your healthcare provider, that's how you can reduce that risk of falling too. Is your vision at its optimum as what it should be? Wearing safety belts in the car, of course, helmets if you're going on bike rides, and then getting enough sleep. Depression. Depression is not a normal part of aging. Many people think it is, that as we get older, we might feel lonelier and we just feel more sad. But depression is that feeling of sadness or loss of interest that lasts for weeks at a time. It's not in like small moments in time. And small moments in time where we feel sad or blue, that's part of being a human being. But sadness that stays for long periods of time, you should start to see if there is a diagnosis of depression going on. Some medications can cause depression, but also some disease states that can come on later on with life. Underactive thyroid, for example, can start to cause depression in people. And there is good treatment, not just with medications, but with a good clinical psychologist or clinical social worker, cognitive behavioral therapy. These approaches can do just as good for depression as medications. Sleep apnea. This is where we have short pauses in our breathing while we're sleeping, and that can actually increase the risk for heart disease and stroke, memory loss, and a lot of lifestyle changes can help with sleep apnea as well. Alcohol is one of them. We talked about that earlier, and initially if you have a drink before bedtime, you may find that, you feel a little looser or you feel a little sleepier and you think, well, maybe it'll help me fall asleep. What actually starts to happen over time of doing that regularly is you don't get your proper REM sleep anymore. REM stands for rapid eye movement, and that's the restorative aspects of your sleep. And you wake up into that REM sleep cycle, and you might be awake for a while, and you're not getting that full REM sleep to restore. So alcohol actually is not part of a good lifestyle treatment for conditions like sleep apnea. But also losing weight. 10% of our body mass might be lost, and it might decrease the need to go on CPAP machines. So a lot of things can be done looking at lifestyle treatments for early or milder sleep apnea. And then of course the use of special devices, the CPAP, for if it's ordered by your doctor. And if you've never gone through a sleep study, we feel that this might be the tip of the iceberg for a lot of people with different underlying chronic diseases. And so there are sleep medicine studies. That doesn't mean always CPAP. Many people will think, well, I don't want to go through a sleep study because I don't want to go on a machine like that. There's different levels of sleep apnea, and there's appropriate treatments for all of those different levels. So if you've ever wondered, you or your spouse might be having some sleep apnea, it's still a really good idea to get tested first and then talk about the treatment options after that. So what can we do to help our brain? Eat healthy foods, be active, learning new things, and that connection with family, friends, and communities. Out of that whole list, I think the most important one is that bottom bullet point. We can't let ourselves be socially isolated, because that's when we start to have these effects even more so on our cognitive thinking and our brain. So we want to take care of our general health, managing health problems like diabetes, high blood pressure, high cholesterol. You want to talk with your healthcare provider, your primary care physician, to see what medications are right for you. We want to make sure we reduce those risks for brain injuries due to falls. And if you're a smoker today and you're interested in being a non-smoker for tomorrow, there's help for you. We can get through this journey together. Eat healthily with fruits and vegetables, whole grains, lean meats, fish and protein, poultry, less solid fat and sugar and salt, proper portion sizes. We forget about portion sizes sometimes. We think that more is better. And then adequate fluids. As we age, our bodies get drier. And so it's important to keep up with fluids because all things work better. There's more lubrication in our body when we're more hydrated. Get moving. Getting at least 150 minutes of exercise each week. And there's different programs that can get you to learn to move safely. That's why we're going to be having a presentation later with one of our SamFit people. Keeping your mind active, mentally stimulating activities, reading books and magazines, playing games, taking or teaching a class. It's never too late to take a class from the community college. A lot of people do this. And being social throughout working or volunteering. Now, Not all of those things have been proven to prevent Alzheimer's, but they're really fun and they're seen as trying to decrease that sense of social isolation again. And this is where it's important to stay connected with people that have other meaningful activities that you share. They feel happier, they feel healthier. So what can you do today? Pick one thing that you can think of from the presentation so far that might help you with your brain. But think of it as those small, easy steps. Something like taking a walk a few times a week if you haven't been walking yet. Or adding a serving of vegetables into your diet. Write down what you'll do. So you have pens at the places there, and you can write down one of your things that you can do today onward, and getting support from family and friends. When we talk about doing something to advocate for our health, and you tell somebody else about it, chances are you're going to stick with it. This is included in your packet, but there's more information there with different websites from councils of aging. And we're going to have time at the end of this for questions as well.